We're now looking at the thoracic region. In fact, this is the thoracic region close-up in primal. We are now staring at the thoracic spine. We can see the spinous processes, transverse processes, the area of the rib, which you should know, that is articulating with the transverse process. This is the supraspinous ligament. You can see that it's running from the tips of all of the spinous processes in the thoracic spine. Deep to that are the various interspinous ligaments that connect the spinous processes together. This is ligamentum flavum. We've showed you that in a previous video. This structure here is the intertransverse ligament. It's important that you keep track of that. It is a ligament that you will need to know. Now we start to see a whole array as we come to the sides. You can see maybe a better appreciation of the interspinous ligament. This structure here is the superior costal transverse ligament. You can read all of the structures and what's important over here later. So the radiate ligaments of the heads of the ribs, anterior longitudinal ligament. Switching views to a more posterior view again. We now have a bunch of little muscles, and one of the things that you're going to find is that in the body, particularly in the spine, there's a lot of little muscles that are important for us. This is levator costorum brevis, which is the muscle that helps elevate the ribs. It's found between C7 and T11. This is levator costorum longus. This is the transversospinalis, which is a rotator of the thoracic spine. More detailed picture, you can actually see this muscle here is the transversospinalis, so the rotator of the thoracic spine. For those of you who remember from the cervical spine, this structure here in green is longus coli, and there are two heads of that little beastie. Actually, there's three heads, but I'm showing you two, inferior oblique and then the vertical intermediate. Again, just know longus coli. If you remember, I was pretty specific about that. You don't need to go into that much detail into the different heads of longus coli for semester one for sure. Anterior longitudinal ligament again. So now we've added some more deep rotators. These are the multifidus. The multifidus is a muscle that crosses multiple vertebral levels. We've discussed this in the past in the cervical spine. No different in the thoracic and lumbar spines, where you have a very deep rotator. It can attach based on different layers of the multifidus from anywhere from 1 to 4 vertebrae above its attachment. These are the intercostal muscles, the intimus, which is the internal muscle of, or the most deep intercostal muscle. Going up a layer, this is semispinalis thoracis, or the semispinalis thoracis. This is the internal intercostal muscle. Over here it says ninth just because it's it's the ninth one down. Cognizant of the fact that there are 3 different layers of the intercostal muscles, we're just looking at the internus or internal one. Remember, there was that intima as well. Analogy would be external oblique, internal oblique, and transverse abdominis, but of course we don't have that here. That's why they call it the intimus. The external intercostal muscle, erector spinae, sacrospinalis muscle in the thoracic region. Continuing on with the erector spinae, this is longissimus thoracis, and then this is iliocostalis thoracis. So the 3 muscles of the erector spinae. We'll start again. The iliocostalis, longissimus, spinalis muscles. Now we start to see the splenius cervicis here, splenius capitis there. It's just to keep you orientated to where we are. These are the scapula. That would make this serratus anterior. This is the iliocostalis lumborum coming up from the low back or the lumbar spine, i.e. iliocostalis lumborum, and attaching to these ribs. The thoracolumbar fascia, which we talk about extensively in all semesters. Here is serratus posterior superior, serratus posterior inferior. We talked about the rhomboids before, but this is rhomboids major. We would see rhomboid minor above it. Here is the trapezius muscle, and then of course that would make this the lats. Now the traps are divided into upper, middle, and lower trap based upon their orientation of their fibers. You can see that this is angulated upward. We switch to a larger, more exterior view. These muscles here that are going in a horizontal direction would be mid-trap, and the ones that you can't quite see because of the up and in towards the cervical spine would be the upper trap. Looking at the fiber orientation is important because if you see muscles in the trapezius area that are headed towards the scapula, In upward direction, that's lower trap. Horizontal direction, that's mid trap. And then coming down from the neck, of course, or up to the neck would be the upper trap. Again, here's our friends, the lats.